Good morning, everyone. The importance of global emergency preparedness and resilience has become more pronounced than ever. Whether it be natural disasters, pandemics, or geopolitical tensions, our world faces an array of threats that demand collective and strategic readiness. When it comes to health in an emergency, community and frontline workers, 70% of whom are women, are the backbone of the emergency response efforts. Their skills, commitment, and ability to work under pressure are critical for minimizing the impact of crises and safeguarding public health on a global scale. Acknowledging and supporting their efforts is vital to the building of resilient healthcare systems that can effectively respond to the challenges posed by emergencies, as well as the everyday needs of people globally. Our two panelists are going to talk about these topics and share learnings and proof points from efforts around the world to empower women working at the front lines, including a unique program that you just saw now in that brief introductory video. So with that, I first would like to thank our sponsor, Abbott, our lunch sponsor, and their wonderful partner, CARE. I would like to introduce our speakers today. Catherine McKenzie is Divisional Vice President of Global Citizenship and Sustainability at Abbott, where she leads a team working to shape the future of healthcare and helping people live better and healthier. She also serves as Vice President of the Abbott Fund, the company's philanthropic foundation, which partners with others to expand healthcare, access to healthcare, strengthen communities worldwide, and promote science and health education. Ritu Sharma is the Vice President for U.S. Programs and Policy Advocacy at CARE. She guides the organization's advocacy towards the U.S. government, international institutions, and across 42 national governments. CARE is launching a programmatic and policy initiative called She Heals the World for community and frontline workers to get resources needed to be empowered agents of change in their communities. Ritu is the founder of Women Thrive Worldwide and the author of Teach a Woman to Fish, Overcoming Poverty Around the Globe. Please welcome our speakers. And with that, I would love to begin today's discussion. So, what are community and frontline health workers, and why are they so important, and what role do they play in an emergency and more broadly in healthcare? Ritu, I'd love to begin with you.
Great. Thanks so much. And first, happy, healthy International Women's Day. I know it's not for another 8 days, but the celebrations are already starting. What are community and frontline healthcare workers? They are the people who care for you. They are the doctors, the nurses, the health educators, the volunteers that bring us the healthcare that we need. And in most countries around the world, they are literally the only healthcare professional millions, actually billions of people will ever see. They are 70% women, and especially when we look at the volunteer health workforce, that is predominantly women who are working for free, which we kind of have a tendency to do that, don't we? So at CARE, we are launching a new initiative called She Heals the World. And the point of it is to help support and make visible all of these millions of women who are doing incredible work to keep communities healthy. They are not recognized. They are often unpaid or underpaid. They lack health care themselves. They don't have transportation benefits to even do the work that they do. So we have begun really seeing this workforce as an invisible army that is actually taking care of the health needs of billions of people. And it's time to make them visible. It's time to protect them. It's time to pay them. It's time to promote them. And it's time to prioritize them. So I'll stop there and we'll talk more about it.
Wonderful. Well, thank you, Ritu, for highlighting the work of community and frontline health workers. Now, Catherine, I'll turn to you to bring this to life a bit. Can you paint the picture for us about the Care Abbott program that supported community health volunteers in the Philippines?
Absolutely. Hi, everyone. Well, global crises and challenges are on everyone's mind right now, as has already been highlighted this morning. And I think we're all looking at the impact on families and communities and how we can help. This was top of mind for Abbott back in 2018, and we've been working for many years on supporting the immediate needs in humanitarian settings, right? Things like water, shelter, food, urgent medical needs. But one of the things we know in crisis settings is, while the focus is naturally on trauma and infectious disease, is that non-communicable diseases like diabetes, heart disease are often neglected. The other thing that is often overlooked, has been well highlighted this morning, is the outsized impact of those crises on women, but also the untapped potential of women to lead and deliver change. So that is why in 2018, Abbott reached out to CARE, and we created together the Future Well in Crisis in Marawi in the Philippines. And the focus of this was really to build a scalable and replicable model in a resource-limited environment to prevent and treat non-communicable diseases through counseling, building capacity, education, and screening. And this really built actually on the strengths of both CARE, so we know CARE empowering women, mobilizing communities, and capacity building, and Abbott's expertise in health technology and non-communicable diseases. A key focus here was really mobilizing the displaced population, especially women. And I think we sometimes think about a displaced population as a group of people waiting for help, rather than thinking about this pool of resources, right? Amongst that population, there are trained professionals, doctors, nurses, educators, and trusted individuals within that community. And then we also know that women really have this central role, this important role for health. They're the ones in charge of health for themselves and for their families. So taking these displaced women and really tapping into their connectiveness in the community and their drive and influence was crucial for this program to work. And so they created these NCD clubs, non-communicable disease clubs, where they were screening, they're monitoring health and heart indicators, and giving education on healthy habits. So let's talk about the results. Well, they were extremely positive, right? Firstly, people with diabetes and prediabetes had significant improvements in their blood glucose levels. By year 2 of the program, over 80% of the participants had reduced their risk of a cardiovascular event. And then importantly, I want to stress 2 things, is building this from the beginning, working with the government. And so in Marawi, we were working with local health authorities from the get-go. And actually what happened is these community health volunteers and workers shone a light on the need for diabetes services here in this city. And there was 100% increase in people going to the local government health system, and it provided the data. And so now with this data, there was an increase in budget, not only for diabetes services, but also for the healthcare workers. And then the other thing I'll just emphasize was the impact on these women themselves and the perception of the community towards them. And so through this role, this increased influence, the responsibilities, it led to this increased opinion of the women and help reduce the gender inequity, even if there's more to do.
Thank you, Catherine. You just spoke about the increased influence of the community health workers and the impact that they had in terms of drawing attention to some of the illnesses that existed in the community, in this instance, diabetes. but also how that illustrated some of the concerns and challenges, health challenges that existed to the local government, and they listened. And yet, more community health workers are needed around the world. So why is there a shortage? And Ritu, how is CARE working to address that?
Yeah, that's a great question. And as all of us look back on the last 3 or 4 years, 4 years now, since COVID started, I think we're all really very aware of the toll that it took on healthcare workers in our country, the doctors and the nurses and the educators and the vaccinators who were working 24/7. Well, imagine the impact it had on community health workers all around the world who were not paid to begin with. So what we saw over COVID is a huge, huge drop in the number of community and frontline healthcare workers, both paid and unpaid. And now we have about an 18 million person gap in the healthcare workforce around the world. I think there's two sides. The silver lining to that gap is that this is an incredible economic opportunity for women. But that depends on these jobs being paid and being respected. So lots of reasons that they burn out. They don't have access to supervision or training. They don't get transportation benefits. They don't get health care themselves. So it's not, community health work is not somewhere where people see themselves staying. A young person may do it, they get some experience, they use that to level up and to try to springboard into the government health system. But for most people, that opportunity won't be there. One of the really fantastic things about this program in Marawi is that the community health workers fix the leaky pipe in the data between the community and the Ministry of Health. And what's so interesting in this case is that the national government actually has resources for community health, for control of NCDs. But they didn't have the data, so they didn't know the need in the community, and they weren't allocating resources there. And one of the long-term impacts of this program has been that a number of those community health workers were brought onto the roles of the national health system, and now they have some remuneration to do this community work that they're doing. And now the national government has done what we want national governments to do, which is take responsibility for the health care of their own citizens. And so this example is this just amazing microcosm of how the exponential kind of multiplier effect this kind of program can have, and the hope is to replicate it.
Has been replicated actually already very successfully in other disaster crisis situations in the Philippines.
Well, thank you, Ritu, and thank you, Catherine. As you all spoke, it's highlighted the importance of partnership. As you said, Ritu, this gap in the workforce represents an incredible economic opportunity for women. So with that, I want to ask you, Catherine, how can businesses and communities scale up what works to support frontline health workers?
Such an important question. We say that good health is the backbone of our world. We all see that in our own lives and our families, but it's what animates economies and societies. And the time to invest in that, in our public health system, to invest in healthcare workers is now. It's not when the next pandemic or the next emergency strikes. And the investment needs to come from multiple sources, from governments, from local communities who are building that infrastructure and really working towards those health outcomes, and then from companies and the private sector to use their resources and expertise in finding those innovative solutions to help improve healthcare. If you look at Abbott's 2030 sustainability plan, the central focus there is around innovating for access and affordability, building those considerations in from the get-go. And part of doing that and addressing health inequities is through partnership. And we have all seen and heard today so many great examples of how the incredible impact of investing in women and how that can have such an impact on healthcare. Because women have this unique understanding of the health needs and challenges for their own communities. So I'm going to give you a couple more examples in some different settings. In India, through a 5-year partnership with the Self-Employed Women's Association, SEVA, we've trained over 400 women in low-income communities to become healthcare workers. And this has led to all the things that you would want it to. So increased healthcare access, early detection of diseases, really thinking about outcomes, and then importantly, building in that resilience into the population. And then coming back to what Ritu was just talking about, this is also helping the women themselves build their own livelihoods as these healthcare workers, and they have become these trusted agents of change within their own communities. And this is happening right here in the US as well. So I wanted to also share an example from our Future Well Communities program in Stockton, California. So in Stockton, 60% of the population, 60 with my accent, 60% of the population have diabetes or pre-diabetes. And we have been working with the University of the Pacific to create 4 new educational programs with a subspecialization in diabetes care, and mobilizing the local healthcare workforce, but also health and social workers to be able to fight this epidemic where they live and work. And one of my most rewarding moments from this past year is meeting some of those healthcare workers who've taken the non-clinical certificate in diabetes care and who are now talking to their own family, friends, expanded network, and addressing what is often thought of as the inevitability of diabetes in Stockton. So in all of these programs, we have them going in several other communities as well. We're really focused on building a sustainable ecosystem. That's really important. Connecting people with the health services, health care, and social services that they need. And I'm going to bring it back to the title of this panel, right? Every day, women are on the front lines of healthcare, bringing real-life solutions to health challenges globally. We need to invest in women today so they can take care of health in the future. And it needs to be today, because if we're going to withstand, if we're going to build the capacities for those next pandemics and be able to absorb shock, mitigate some of those emergencies, recover more swiftly, and have the functionality in place, not only in crisis settings, but in those everyday situations of health challenges around the world, women are going to be an essential part of the answer.
Thank you so much, Catherine, and thank you, Ritu, for offering your perspective on the work that CARE is doing to address the investments in frontline health workers. You know, throughout this conversation, both of you have highlighted some key components: the role of community health workers and frontline workers, the importance of partnerships, you know, as demonstrated by the work that you all are doing, and investments in the women and community members who are already living in the communities and doing the important work. You spoke about embedding innovative solutions that relate to access and affordability in your work, but also understanding that investing in women and health has long-term impact, once again, not just for their families and their communities, but for the larger country as well. And I love the examples that you provided in Marawa, Philippines, of course in India, and Stockton, California, so bringing it closer to home, and understanding that this work isn't just taking place far away, but we also have the importance of community health workers here as well in the US. So just wanted to thank both of you for joining me and for highlighting your important work. And I also want to thank all of you for being a part of this conversation. So thank you so much.
Great. Thank you.